Thank you very much for inviting me to participate in this great conference. I'm really excited to be here today to talk to you about how early childhood systems can leverage the significant disruptions that have happened through the pandemic to actually build more equitable, resilient early childhood systems. Since last March, I've had really the privilege to witness the amazing responses that early childhood and other community leaders have been making in communities. And I've been really struck by what I've seen in terms of the strength and capacity within communities. And I really am hoping that today's session will help you identify how you can leverage what both you've done and what you're going to learn from your peers today, hopefully, to help strengthen your systems in moving forward. And one of the things that we know for sure, and we don't need to spend any time talking about this, is that this pandemic has created just significant disruptions for families, communities, and early childhood systems on really every dimension. And one of the things that I've been most impressed with is that I think the early childhood networks were one of the most disrupted systems because of the loss and the asks of them during this pandemic time. And they were also one of the most effective at creating innovative and adaptive solutions. And what I mean by that is we just saw across the country, and you probably saw this, you probably created these in your community, many quick and adaptive responses that were done simply because early childhood systems were asked, how do we help keep our families intact and our children safe? And so we saw programs go online that had never been online before. We saw whole communities create tremendous mutual aid networks, often led by the early childhood systems and their partners, food, diapers, formula, et cetera. We also saw community organizations and early childhood systems completely alter the way services were delivered to make access easier so that people could get the services that they needed. What is most important to note about this is that the early childhood systems and the communities that they're in really showed significant resiliency in their ability to respond to that pandemic. And I'm going to be talking about what this resiliency is and why it's so important to leverage to create more equitable early childhood and community systems. In addition, I really think that we need to accept the fact that what the pandemic has given us is honestly a gift. And that is a gift to reimagine a better community system, a more effective and more equitable early childhood system. I know that in some of the changes I've seen around the United States, the changes that were made actually made the systems better and helped children and families get their needs met. Certainly there's lots of loss, certainly there's lots of hardship, but I also think there is an opportunity for us to take what this pandemic has forced us to do to reimagine something better. And this workshop is really designed to help you in a very intentional way do some of that reimagination. And there are two parts to this workshop. In the first part, we're going to really pause and reflect very intentionally around, well, what were our resilient responses? What is resiliency? And what did we do in our early childhood system that was a resilient response? And what were the impact of those responses? And which ones do we want to keep? And then we're also going to talk about how can you intentionally grow your resiliency? Because resiliency not only helps you be able to manage change, but it also makes you a more effective system at meeting people's needs. Both of these parts of the talk have tools associated with them. And I'm hoping that you've downloaded those tools that were on the website because we're going to be referencing those today. Today is also designed to support some crowdsourcing. There is nothing better than learning from your peers about what they've done to improve their early childhood system in response to the pandemic. So there's going to be several ways for this crowdsourcing to have today. You will have the links and access to the ideas that your peers share at the end of this conference. So let's first start with, well, what is resiliency? What is this thing that we say is resiliency? I'm going to share with you a couple of images, and I want you to pick the one photo that to you best represents what resiliency means? As you think back on this last year in your early childhood system, which of the following images best represents what resiliency means? And what I want you to do is to write down or remember that number, because we're going to have a poll and you're going to be able to respond to that poll. Okay, so take a minute and pick which photo it is. There are 5 photos, and just remember which image you selected. Okay, and so now we're going to have poll 1 released, and you're going to get to share which one of those images best represented to you what resiliency means. Okay, so as we can see, if we look at these images again, the majority of people said photo 1. And that's this idea that we're resilient when we're able to grow and thrive despite really bad and harsh conditions that don't look like they're that conducive to growth, right? And then photo 2, a chameleon. Resiliency is about change and being able to adapt to that change. We also had people say those bouncing balls in photo number 5 really resonated with me, because resiliency means able to bounce back. It also could have meant that there was a lot of balls in the air, and that's what in being able to handle all those balls in the air. But we also had people who identified photo 3 and photo 4 as representing resiliency. All of these are actually representative of some of the definitions that you find when you go into the literature about what is resiliency. Okay, so let's look at that for just a minute, okay? When you go into the literature, and this idea of resiliency is actually a very popular concept right now. You're seeing it pop up in lots of people's conversations about whatever sector it is. This is what they needed to respond effectively to the pandemic. So it's your ability to bounce or spring back, to absorb a disturbance or a change, meet current demands, cope with shocks and emergent uncertainty. I'm hoping that as you look at these definitions, you're nodding your head and you're saying, yeah, that was my last year. Those are the things that we were asked to do because of the pandemic. I think what's also important to know is that the way we respond resiliently to those kinds of stressors and demands can have different levels or degrees of change in our system. Sometimes we're able to absorb those shocks and those demands without any real noticeable changes to what we're doing. We might just have to do more of it. I saw this in some of the communities where I worked, where their food pantries were able to continue to operate as they did. They just were serving more people. So they were really able to absorb the demand for more food because they got more donations and more volunteers. We also saw a lot of communities and early childhood systems where they had to be incredibly flexible and adjust the way they provided services or delivered services and how they offered them. I think the best example of flexibility is when we see all the move to telenet as a way. So we're still providing the same kinds of services, we're just delivering them in a different kind of way. And then we've also seen systems really completely change what they're doing and what they're offering because of what the pandemic demanded. I saw a lot of community systems reallocate resources in ways so that, for example, mental health providers were more available in some sectors that never had mental health before, because the need for families to have access to easy access to mental health providers was so important. So let's sort of start our exploration together around resiliency. I'm going to ask each of you to think about what's one response to the pandemic that your early childhood system made. And I want you to share that in the chat. Type that in the chat. And so what is one response your early childhood system made? And let's share those with each other. Let's just sort of start to trigger this crowdsourcing piece so we can see, how did your system respond to the pandemic? So we're seeing lots of telenet, reaching out to people via Zoom, FaceTime, virtual home visiting, providing PPE to organizations and to centers, waiving parent fees paying them yourselves, working from home, so staff, making policy shifts, creating resources differently. So a whole array of changes, both in terms of how services were delivered, what they were delivered, reducing, shifting costs and policy, probably perhaps eligibility requirements as well. So keep typing those in. We're going to have more opportunities for you to share, but lots of ways that organizations and communities have responded to the pandemic. And so I think before we dive a little bit more deeply into this, let's just pause and ask, well, why bother thinking about these resilient responses? That was a lot of work. I want to say goodbye to them and move on. Well, the reason is that what we know when we look at other communities and organizations that have had to respond in a resilient way to some other crisis is that healthy systems and organizations actually leverage these disruptive events and their responses to them to actually improve themselves. And so that's why I said this is that reimagining opportunity. And so the goal is post-pandemic, how can we be better than we ever were before? And the best systems and organizations actually take the intentional time to reflect on and answer that question. And the reason they're able to do that is that this kind of disruption that we've all lived for actually makes change easier. Because it frees us. The stuff that we thought was impossible to change actually could change. I have had community leaders say to me, I never knew before the hood system or any other system in the way that we did in this way. And so again, this process allows us to make change happen and we now have new opportunities for change in a way that we never did before. These disruptive events also create opportunities for what's called system reflexivity. And that's the time we take to pause ourselves and really interrogate and reimagine what we took for granted. I have to say that the rise of the conversation and the awareness of the significant inequities that are present in every single domain in children and families' lives inside communities has really given us not only the opportunity to do this reflexivity, but almost also the moral obligation to do that kind of checking in and asking, why are these inequities still happening? The other thing to remember is that systems like the status quo, they like being the way they've been. And unless we intentionally spend the time reinforcing and embedding into our practices what we want to keep, then they're going to go away. And so that's why, for me, it's really important that we do this pause and this intentional reflection. And so I designed a tool that I've been using with communities to really look at and pay attention to how can we leverage the learning from our resilient responses. And so there's a tool, if you happen to download it, it'd be great if you made that accessible right now. If not, I have screenshots that we can use together and you can download it later. But there are 3 things this tool is designed to do. It's designed to help you first pause and identify what those resilient responses are, capture the insights about your system that these responses are helping you reflect on, and then intentionally maximize the possibilities for improving your system moving forward by leveraging the changes that you've done that are making your system better. So I think it's important to note that for me, what's most exciting about the kinds of changes people did is that they actually made the system better, okay? And so one way to sort of look at that is to sort of look at the framework developed by Pennie and colleagues on what's inside a system. And they sort of have 3 layers of it. So what we saw, and we saw this in the chat too, is that these resilient responses shifted what systems did. It shifted policies and procedures. It shifted how things were practiced or done, like Telenet. It shifted how resources flowed and who had access to what resources. It shifted roles and responsibilities. I saw a lot more citizen and parent engagement in a lot of communities, for example. It also provided new relationships and new connections that were made that never existed before. In some communities I worked for, the faith-based community stepped up and joined forces with the early childhood system in a way it never had before, offering food pantries and diaper drives, for example. It redistributed authority. No longer in some communities, people have to go up the full chain of command in order to take action. They were empowered to take action on their own when at the direct line of service. It also shifted mindsets. Everybody now believes everybody should have access to childcare in a way they hadn't before. It shifted our mindsets about equity and inequities. And it's actually made, I believe, a robust childcare network a priority. We're seeing this in some proposals from our elected federal officials. And it's also made equity a priority too. And so as you're thinking about your resilient responses, sometimes it helps to look at this framework, and this framework is in the handouts I gave, and it's also inside the tool. So what I want you to do for just a couple of minutes is, whether you have the tool or not, it could be on a piece of paper, I just want you to brainstorm what are, say 3 to 5 changes or adaptations that your early childhood system or organization made and respond to the pandemic. And so just take a few minutes and make those, think about those changes. And I'll go back to this slide to help trigger some ideas for you. So take a few minutes, because we're going to go into breakout rooms and you're going to have an opportunity to share some of these brainstormed ideas. So take a couple of minutes and think about what these are for yourself before we move in that direction. So just pause that brainstorming for a minute. After we sort of identify, well, what are the changes we've made, we have to ask ourselves, well, what do these changes really mean for our early childhood system? Like, are these things what was the benefit? What impact do they have? And so there's a second poll that I'd like our TA people to release to help get us to begin thinking about the kind of impacts that our changes have made in our early childhood system. So if you could release poll 2, please. So it's looking like everybody that has responded is actually saying the resilient response made things better pre-pandemic for children and families. And that's actually what I've seen in all of the communities that I've worked in. There are some things that have absolutely made systems, early childhood systems in other communities, other parts of the system better. And so that makes it even more important that we are really good at identifying what we want to keep and how we're going to keep it. And so now let's release poll 3, if you don't mind. So this is asking, because of the changes that you made, what impact did they have on inequities? Were some of those responses, did they reduce local inequities? Did they make them worse, or both of the above? Okay, so it looks like the majority of people are saying that the responses you made both reduced local inequities as well as made local inequities worse. Some people felt that they only improved local inequities. This even highlights even more how important it is that we're intentional in thinking through, as we move to a post-pandemic world, what about our changes do we want to keep? Because we certainly don't want to maintain those practices or those changes that made inequity worse. So there are 3 kinds of system insights that I believe this kind of reflection can do for us. We can ask ourselves, well, what were the impacts or outcomes as a result of the changes that we made? What were the benefits, for example, for children and families, for our organization, for our employees? We can ask ourselves, well, what did these changes reveal about our system? Were there some hidden capacities, for example, that emerged that I never knew existed before? And then they also tell us about our system and equity and inequity. And we need to be paying particular attention to how these changes impacted our desire and need to shift and reduce local inequities. And why paying attention to those things is really important is because we need to think through, well, given not only what we did, but also its impact. I think there are 4 choices we can make for all of the changes that we've been making to systems during the pandemic. We can select to keep some things, and these are the things that are like the win-wins. It was good, it had great impact, and it's also helping us move forward on our goal to create a more equitable system. Oh, we found some things that we tried out, they're not quite right, so we might need to change them to make our system better. Oh, this idea made things worse in any kind of way, let's not do it again. Or, hey, we tried some things out and we discovered there are some other things our system needs, and we're going to start to create those. This is a framework that was developed by Bobby Williams in New Zealand, and it's a great way when pursuing changes or seeing changes in a community to identify, well, what is it that we want to try to keep and retain, and what, for some reason, do we want to try to get rid of? And so we're going to move now using those ideas into this crowdsourcing opportunity. And I'm going to be moving you into some breakout rooms using Jamboard. And there are a couple of key questions that I'm going to ask all of you to be paying attention to. If you don't have the printouts, don't worry about this. These questions are also in the Jamboard when you go there. And so I'm going to ask you to identify and to share with your Jamboard breakout room members, what is one change that you made in your early childhood system during the pandemic that you want to see remain post-pandemic, because it made things better for children and families, and hopefully if it reduced inequities. And I want you to talk about what impact it had. Okay, so what's the change and what was the impact? That will help us understand why you want to keep it. And then I want you to be talking in your group about what is it going to take to keep your changes post-pandemic. So everybody's going to share their answers to 1 and 2. And then as a group, you're going to say, well, these are the kinds of things happening in our system that we want to keep. What do we need to do? What's it going to take to make sure these things are sustained post-pandemic? You're going to write on a sticky note, and here's an example of how to do this, the kinds of details that are needed. Again, if you think about this as crowdsourcing, other people should be able to look at your answers and get a sense of what you did. If you feel comfortable, you can share your name at the bottom and where you're from. So if somebody wants to reach out to you to find out more about what you did, it's easy for them to do that. You're not required in any way to put your name on. It's just there as an option, okay? So provide details on your sticky so people can really understand what it is that you did. You are going to be assigned to a breakout room, and you're going to have about 25 minutes in your breakout rooms to share with each other your resilient responses, the impacts, and to discuss collectively, well, what can we do as systems in order to keep these changes alive, okay? So when you get into your breakout room, first introduce yourselves, okay? You're going to then be given a Jamboard link. It's going to come into your breakout room, and that's the link that your group is going to go to. Everybody is going to click on that link, and you're going to move to the page linked to your breakout group number, okay? Then you're going to use the stickies as I just described. You're going to type your response onto a sticky, and then each person in a round robin way is going to share what they put on the sticky, and then you're going to be opened up for conversations. Keep track of time. You have about 25 minutes. We will be jumping in and checking in to see how everybody is doing. So remember, you're going to have 2 things open. You're going to keep your Zoom open so you can talk to each other. And then you're going to be in your Jamboard session in your browser so you can each see what everybody is writing. And so you're going to be invited now to join a breakout room, accept that invitation so you can move to your breakout room and start your introductions. And then you will get your Jamboard link. Great. Welcome back, everybody. And as you come back, what I'd like you to reflect on is, what did you discover in these conversations with your peers? Type in one discovery in the chat box. So as you reflect on those conversations, what did you discover with your peers? If you could just take a quick minute and type that into the chat box. What did you discover through your conversations with your peers, and type that into the chat box.
Stop, don't throw it away. You don't have any to play with. Don't throw it away.
Gosh.
So what did you discover? Type that into the chat box if you have a minute. It seems there's a theme about the low pay of early childhood workers, but that every county had some very similar struggles, similar experiences across counties in terms of what they did, common goals. That the goal is to be resilient, but you had to learn as you went. And lots of commonalities in this experience. And I have to say, that's been my experience. It doesn't matter what community I'm talking to, really the stories they're sharing about what they're doing to not only survive, but thrive during the pandemic is very similar. So great. So in this idea of flexibility, being cool, being critical to the work, and the fact that one of the gifts of the pandemic is it has created the reality that it's now okay to provide services or to do this work in lots of ways that were not allowed before, and that flexibility is creating great benefits for both organizations as well as for children and families. Okay, so keep typing in those discoveries as we move on to sort of the next part of this conversation. And we're going to really sort of move to sort of the next question, which is, how do you use this at home? So this tool is really created to provoke this kind of intentional reflection and conversation at home. And I'm going to share with you how I'm seeing other communities use it as they go about their work. And so the most important thing is that you want to be thinking about how do I engage my colleagues and partners in this kind of reflective process? And part of it is just asking questions. So I'm seeing people bring these questions into staff meetings, leadership team meetings. I've seen people actually, one county here in Michigan is actually sponsoring resilient community conversations. And interestingly enough, they partnered with the local county commissioners, and they're running different groups around the counties and inviting all of the cross-sector leaders to join in one of those conversations. So as a county, they can think about what they want to keep as they move forward. I'm seeing people put some of the tools into their agenda or to use parts of the tools in their meeting agenda. They're running focus groups to ask people about this. I've seen some people turn these items into a survey. And most important of all, people are beginning to bring these questions into the conversations with their constituents, asking families themselves, what are the changes that you want us to make sure we keep moving forward? That's a really important part of this process. Okay, so I said there would be two tools and sort of two parts to this process today. We talked about resiliency and what it is, and in your responses, which ones you want to try to keep moving forward. We're going to now talk about growing your resiliency. And that's because we know that the more adaptive you are, the better equipped you are to meet local needs, as well as to respond effectively when the world becomes more dynamic than we may want it to be. So I want you to think for a minute about all that you did as a system, early childhood system in this past year. And what is it that really helped your system respond effectively to the pandemic? What allowed you to be so resilient? And think about it. What was it in my system that allowed us to have this kind of flexibility and ability to adapt? And I want you to type some of those inside the chat so we can sort of see what people are saying helped. So we're seeing sort of a commitment to the mission, significant passion for making sure that children and families thrived, having great leadership, being thoughtful and understanding with each other, being able to be flexible, lots of empathy and flexibility. There's actually several studies that have been done recently where people have interviewed early childhood system leaders around the nation and asked them exactly this question. And one of the things that almost every community talked about was the fact that the history inside the early childhood system of building cross-sector collaborative partnerships and early childhood infrastructures played a tremendous role in their ability to provide quick, coordinated responses and flexible use of resources. You know, as one leader said, a pandemic is not the time to be building relationships. It's actually the time to leverage the partnerships that you have. And because early childhood systems have done so much system building and building of those partnerships, that's really important. Another thing that that was heard a lot in these conversations with other system leaders around the country was that people learned they can change the system. I had a conversation with one WIC leader who said, we had no idea the number of changes we could make to WIC and to our program that would make it better and more accessible for families, and we did it. And I now know that we can change the system. So it was both people discovering the power that they had and leveraging those great partnerships that really made a difference. We also know from research on other communities around the world about what helps them thrive at a moment like a pandemic or other crisis is their ability to have what's called adaptive capacity. And this is the characteristics that you have inside your early childhood system that empower all of your stakeholders to effectively respond to change. And what I think is really important is, for me, adaptive capacity is really the next goal in early childhood system building. We know from lots of research in other kinds of sectors that the more organizations and those systems have adaptive capacity, the more they are able to accomplish their goals and reduce inequity. And so what I want to do is share with you what are the elements of adaptive capacity. And I'm going to talk about how you can sort of leverage the capacities you have and start to build new ones. There is a tool, again, that was provided on the website that is around assessing adaptive capacity. And again, this is meant to be a reflective tool. What I want to share with you are what are the key elements of adaptive capacity that you see over and over again and in the research and case studies. The first one is social capital and civic mindedness. And I'm not quite sure we always think about this as critical in our early childhood system building efforts, but I would say the pandemic highlighted how important this is. So social capital, a key element of this is the degree to which families trust. They trust their neighbors, other people in their community, they trust the local institutions, they trust government, and they believe it is their job to take care of the broader community. And we actually know from research around the world that the more residents reported a higher level of social capital and civic mindedness, the more likely they were to support some of the edicts that were coming down from the federal and state government about what needed to be done to keep people safe during this pandemic. Another key capacity of adaptive capacity is diverse perspectives. And I think early childhood systems do this really well already. And this idea is that there are, that the early childhood systems brings lots of perspectives to the table, including families, and that those diverse perspectives are engaged at all stages of the work, from understanding to designing to implementing to learning. And those diverse perspectives are valued and accommodated. Learning capacity. The importance of data was really highlighted in this pandemic, but not just being able to produce data, but to effectively use it and learn from it. In many of the communities that I work with, this is actually one of their weakest links. They either don't have the data that's needed, or the data, they get flooded by the data and they don't necessarily have the time and the capacity to use that as they need to. Self-organizing capacity. This became really important during the pandemic. And the idea here is that I have the ability inside my system to organize with others to solve problems. I don't have to seek permission to do that. I can organize and quickly make a solution. And in some of the communities I worked with, I saw this happening at an amazing rate. Leaders empowered their employees to solve the problems they encountered. System leaders empowered their employees to do that. And the ability to self-organize was really essential to having quick responses to the pandemic. Transformative leadership. We also often think about leaders who can lead us, tell us what to do, but in transformative leadership, there's a couple of key kinds of leaders that we need to find throughout the system. We need leaders who hold the vision and help us remember why we're there. We need leaders who are entrepreneurial, who help us learn and help support us to be innovative, and that innovation was really critical during the pandemic. And we need leaders that have equity front and center and that are really able to lead the system in having and pursuing equitable pursuits. Authority and resources. This is really important, a part of, I think, systems building that we don't often think about in the early childhood sector. We are only as good as the authority we have to carry out the work we try to do. I've worked in a lot of systems around the world where a group of stakeholders are trying to improve business practices, but no business owners are at the table or anybody who can influence business is at the table. And so we're more adaptive and we're more able to change when we have the right people at the table, we have the right authority to do what we need to do, and we have the human and the technological resources to make that happen. The lack of internet connection in all kinds of spaces across America, and the virtual divide, for example, created huge problems in communities' ability to be adaptive. And finally, fair and just governance. And this is both that the way that we make decisions is viewed as fair. We have equity front and center in guiding those decisions. And we're transparent with our broader community. They know the decisions that we're making or not making and why. So these are the elements that pop up front and center. And I really do think they provide some guidance about what communities in the early childhood sector can start to do in thinking about the next step in their systems building work. There is this adaptive capacity assessment tool, as I said. Perhaps they'll put that in the chat box for you to download if you don't have it yet. I want to show you one section of it. There is a section that looks like this for each parts of that model that I just shared with you. Each part has 4 items, and it's just meant for you to check, is this item in place? And so what I'd like you to do is let's look at these self-organizing capacity items for a minute, okay? And I want you to think about which one of these items is and was most important in our community's response to resiliency, okay? So the first one is there was constant communication. Early childhood stakeholders always had access to critical information in real time. Number 2, people are familiar with the roles they can play and the actions they can take to support change. Number 3, stakeholders have the capacity to self-organize and the freedom to create innovative solutions to immediate problems. And number 4, there's lots of network ties. People are connected in all kinds of ways across organizations, units, people, making it easy for information and resources to flow across the system. And so just type in 1, 2, 3, or 4 into the chat. As you think about your system's response to the pandemic, which one of these played the most important role in helping your system respond effectively? Looks like lots of people are saying the ties. That fits in, that fits in with what we saw also in the literature and in the reviews of several different communities. We also have several people noting, 1, that constant communication. Number 3 also is emerging, somewhat popular, that people can self-organize, okay? So why is it important for this self-assessment tool can both tell you, do we have these things in place? So every item on here, experts are saying these things matter and your system should have these things in place. But they also tell us when we're facing change, what can we depend upon to help us change effectively? And so the tool is designed to help you do both of those things, okay? It's designed to help you think about what helped you respond effectively, what were those facilitators, and how can you grow them? What are the assets that currently existed within your system, and how do you leverage them? And what are the gaps in your system, and how do you develop these? So after you do the assessment, at the end of the assessment, there are a couple of summary reflective pages to help you think about those facilitators, assets, and gaps so that you can grow your adaptive capacity to help build a more equitable, effective early childhood system. And again, you can use this tool at home in the same ways we talked about before. I have some communities that are bringing in one section of that tool into a meeting at a time and using then that as a way to think about what might we need to add to our strategic planning process, given what we're learning about our adaptive capacities. And so I just want to sort of move us to a closure here and encourage you to leverage this opportunity to reimagine your early childhood system. There are some incredibly impressive changes that have happened, from policy shifts to practice shifts moving to telenet, to an incredible focus on well-being, both for staff, children, and families, to a repurposing and of whole communities around valuing well-being for children and families and the importance of quality early childcare. So there's an opportunity for you to leverage these shifts and to move forward as you build a more equitable early childhood system. Feel free to reach out to me. You can go to the Jamboard, but we will also download all of those resilient responses and ideas, both from the chats as well as from your colleagues in the Jamboard. And if you would like to receive a copy of that, please don't hesitate to reach out to me about that or about any of these other options or opportunities regarding how to think about resiliency and how to grow your adaptive capacity.